Hey everybody, this is Sam Ryan. Part of our genetic update conferences for this year is to just give you a little heads up on some cancer jargon terminology about cancer cells we'll be using in the conference this year. So that'll save us a little time when the actual conferences begin. Here's some of the terms we're going to look at: neoplasia, tumor, metastasis, benign, founder, transformation, cancer, solid, dispersed, oncology. Just real quick to give us a working definition for those terms. Neoplasia is a very general term that literally translated means new formation. It refers to a rapidly growing abnormal tissue, neoplasia, neoplastic tissue, cancer-like tissue. And neoplasia leads to the development of a neoplasm, which today we would more commonly call a tumor. Neoplasia leads to tumor formation. A tumor, an abnormal mass of cells somewhere in the body growing more rapidly than normal cells. Or another simple way to define tumor: inappropriate accumulation of cells. For some reason, cells are accumulating, usually in a mass, somewhere in the body when they're not supposed to. Now, all cancer originates from one single normal cell that in some way or another acquires DNA damage. And that cell, where all cancer begins, is called the founder cell. It's the founder of the tumor. It's the original single cell with DNA damage, a mutated cell that will transform and develop into the abnormal tumor. And the process of converting is called transformation. The conversion of a normal somatic cell into a mutated cancer cell, a cell then that has malignant potential, the potential to form a malignant tumor. Metastasis is the word that means spreading. Once a tumor forms in its initial stages, when it's probably safe, then cells from the original tumor can spread all through the body, and that is called metastasis. Quick definition: migration of cells from that primary tumor, the initial tumor, into other remote body tissues where they can then give rise to, they can seed secondary tumors. Excuse me. A benign tumor is a tumor that's localized in the area of the body where it originated. It is not spread. It is not metastasized, and usually a benign tumor is safe. It's not going to be a life-threatening tumor. Now, a malignant tumor is a tumor, a growth of cells characterized by uncontrollable growth, invasiveness, and metastasis spreading through the body. And when we talk about malignant tumors, many times we'll use the term life-threatening. Now, all tumors begin as benign tumors. Some will remain benign, they will never spread. But many tumors that begin as benign tumors initially will become invasive, they will metastasize, they'll spread through the body, and that benign tumor becomes a malignant tumor over the course of time. A general definition for the word cancer: the various types of malignant neoplasms, most of which are invasive and metastasize. We'll use that common definition for cancer, the medical definition CA. If you see that in our slides, that's just an abbreviation for cancer. Now, there are about 220 different types of somatic cells in the human body. Any of those can become a founder cell and give rise to tumors, so the experts tell us probably there's around perhaps over 200 actual different types of cancer, depending upon the cell of origin. Now, we often hear somebody say there's going to be a cure for cancer. There will never be a cure for cancer. If there's over 200 types of cancer, there's going to have to be 200 different cures. So there's going to be multiple cures, not a cure. Now, some cures, some therapies will apply to multiple cancers. So there is some overlap there. A solid tumor, that's where the cancer cells are packed together in a solid unified mass. Most tumors are solid tumors. The opposite situation is a dispersed tumor. That's when the cancer cells are proliferating individually instead of in a mass. They're not packed together, they're floating freely as individual cells, and that's where we find leukemias, individual white blood cells in the blood, or lymphomas. Those tend to be dispersed tumors. Oncology is the study of the causation, the pathogenesis, the development of disease from cancer, and the treatment of tumors. Here's some other terminology quickly. A tumor is designated as a carcinoma if the founder cell was an epithelial cell. The tumor is designated sarcoma if that original cell, the founder cell, was a connective tissue cell of mesodermal origin. If the founder cell was a white blood cell, that's called leukemia. The founder cell is a leukocyte. If the founder cell is a lymphocyte, then we have lymphoma. If the founder cell, more specifically, is the melanocyte, the pigment cell in your skin, if that's the founder cell, that develops into melanoma. And of those five, which would be the most common? Number one, most cancers are carcinomas that originate from epithelial cells. A couple more terms real quick. Acute and chronic you'll see connected to tumors and cancer classification. Acute means we have a cancer with a relatively short time course. It's working very fast. Acute means it may be only months from the time the cancer is diagnosed until the death of the patient. Needless to say, that's a very, very difficult situation. Chronic, on the other hand, is the opposite. That's cancer with a relatively long time course, maybe many years, thank goodness, from diagnosis to death. You'll often see those terms connected again with the leukemias and the lymphomas. For instance, somebody may have AML, acute myelocytic leukemia, versus another person diagnosed with a different type of cancer. It's the same cell, but chronic, it's chronic myelocytic leukemia. So those are just a few terms, cancer jargon, we'll be using this year. Want to be familiar with those before we start. That always makes it easier for us to go a little faster. In the meantime, if you want to follow me weekly on Twitter, there's my Twitter account name. I'll be glad to have you listen. We try to get 2 or 3 updates a week out on Twitter. Any information you need about our conferences, you can go to www.samryan.com for information on all the other possibilities with our information. Thank you very much. This is Sam. You can also call me or text if you want. Area code 317-439-7493. Hope to see you this year at one of our conferences. Thank you very much.